We'll get back to a few more questions. Let me move to this idea that, and thank you for those comments, this idea that we as faculty and the students for sure are trapped in our traditional silo style of learning. So they buy textbooks when they get to that class. They're exposed to theories and concepts when they get to that class. And I think sometimes what that leads to is this: every new class is a desperate sprint for survival. They just need to get through this material and survive it. They don't know how it bridges forward. They don't really recognize that there's a lot of stuff they knew in the past. And so there's this constant drinking out of the fire hydrant type experience, and the students they've told me about it. I think we can all as faculty recognize that there's commonly a overload problem. So what we've tried to do, so what you can see here is this disconnected idea, all this foundational information, all disconnected from the patients that we want them to know about, the impairments that we're trying to teach them to examine and treat. And so we are experimenting now with how to build these bridges. So let me give you a quick sample. So connecting gross anatomy to the clinical classes. So the clinical classes are coming in quarter 3 or quarter 4. Anatomy is in the first 2 quarters. And concurrently, they're doing a range of motion MMT class that includes some palpation exam. So Eric reached out and said, hey, would you film some soft tissue palpations so that our students could have that as a resource? So that while they're looking at things on the cadavers, we are linking them to their lab for bony prominences and bony palpation. And when they're looking at muscles, we are also connecting it to their soft tissue palpation. So you can see
pectoralis minor,
all of these videos.
In a supine position. I'm going to go ahead and elevate the shoulder to approximately 90 degrees, support at the elbow. I'm going to come in and palpate the coracoid process.
So you can see that they can listen, they can watch, they can read, they can revisit it whenever they want.
An error has occurred.
Right? So sometimes I think that the students need to have the freedom to explore when the question arises. In bridging to orthopedics, so this is what we've started to do. I felt like this was a great opportunity to begin to invite them to visit the app, to connect source tissues and structures that they're looking at on the body to common patients that I'm going to hope that they have already seen before, or that I'm going to teach them about when they get to ortho, these common clinical patterns. So we have started an email series. The email series starts on Sunday. The first email goes out, so let's say this is knee week on the cadaver. They are going to get a little email from me that says, hey, while we're in the knee week, I want you to think about what are some of the common patients that you might begin to see or you have already seen. So there's just a little bit of didactic information. The students know that this is ungraded. This is just for their enjoyment of learning. It's linked to all the clinical practice guidelines. You can see that we are trying to guide them towards these types of tools. There's no expectation for them to read it. I just want them to know that this is going to be an important part of how we're going to build them up. And they have these little 1-minute videos that they're going to watch. And so they can just click right into it. They're like, ooh, knee osteoarthritis. Yeah, my dad has that. Oh, okay, let's watch how this guy complains of having stiffness after prolonged sitting, stiffness in the morning, pain that can be several areas around the knee. They can watch a little bit about how he moves. So it's just the beginning of pattern recognition. But what the students have written back to me and said is, this is so awesome because now I feel like looking at the anatomy is so much more interesting, right? Looking at patellofemoral pain so what you can see is they go in and watch these little videos and then they can basically look, oh, hamstring strain. Yeah, that's interesting to me. I'll watch that now. Or I can come back and watch it later. IT band syndrome, MCL sprain. So all the common conditions we have a little video for, a little 1-minute video. So this is 7 minutes of time, maybe 10 minutes of time, and they get to watch it if they want. When we link the anatomy to the orthopedic skills, so on Wednesday, we choose a particular common pattern. So they're going to get a little email that says, hey, are you interested in ACL sprains? They're all interested in it. Well, this is knee stability and movement coordination impairments. I know you don't know exactly what that means yet, but this is the language of the guidelines that I want to kind of trickle into your brain for a second. And what you'll see is there's a possible pain pattern. Of course, pain patterns aren't very predictive, but it kind of connects with the student in some way. And here's a picture of anatomy that you're looking at. Oh, awesome. So this ties to what I'm doing now. And oh yeah, that Lockman test. Yeah, I remember that. Well, they can go in and explore if they want. So they can click right into the video. It takes them right into the app, and they can begin to explore a little. So you'll see the app opens. Here's all your sensitivity and specificity, your reliability data. The instructions are below. You know what? To me, it doesn't even matter if the students end up watching it or not. It connects with something that they probably are interested in. So it's about engaging the student and engaging previously known knowledge that I think keeps them excited about what they're learning. So that's kind of what we're doing with the orthopedic side of trying to trickle in this type of content. So we're doing that for Cardiopulm too. So we said, hey, when we're in the chest cavity and we're looking at these structures, you're going to get a little email on Sunday that says these are the most common types of patients. And you're going to watch a little 1-minute video of the things that they complain about. Oh, congestive heart failure. It's hard to breathe. I have swollen limbs. Oh, okay. Yeah, that's interesting. It's a very superficial glimpse. But what I'm trying to do is invite the student to know that they can explore, that they're not trapped in just what I'm teaching them in the moment, that there's a whole reason why we're going through this process. And so a lot of this, of course, the app covers all the skills that they're going to learn in Cardiopulm. So some of the things they've seen before, they can explore it if they want. They don't have to do it. But secretly what I'm doing is showing them where these things are in the app to give them license to explore. So here's a sample. We write these all up in Word first, and then we generate an email and a web page, and then we create a series that we release week by week. And Stacy, I saw your question. I think it's related to wound care. I'm going to get to that in a second. We're very interested in trying to solve that problem, and I'll share with you how. But you see here some of the special tests, some potential ideas about treatment. Hey, by the way, if you want to watch a little video about precautions related to things to keep in mind, signs and symptoms for stopping exercise, all of this they can choose to watch or not. But I think what's happening is students are finding value, and it's adding value to their anatomy experience. So we're doing the same thing for neuroanatomy. We have another, this is about Parkinson's disease. Oh yeah, I've heard of that. Oh wow, it's so common. Oh yeah, this is the part of the brain we're studying about. Cool. Okay. Now, by the way, you have this neuro exam app that I'm going to tease you into to allow you to take a look at. And there are some techniques that you're going to learn that kind of tie into this rigidity idea. So I'm going to take a look. I can watch it if I want. I can revisit it. What I'm trying to say here is, even as the developer of the app, at some point, the faculty or these little email tools are needed to help guide the student to interesting aspects of the app, because there's so much there. It's something that the students have told me. They basically said it's useful if you are able to guide us in little steps along the way. Before we come to another set of questions, I would just say this, that for the Cardiopulm class, the neuro exam class, the range of motion MMT class, all of our lab techniques are now filmed nicely in the app, organized by the actual techniques and what's going to be happening. So the students can actually be told ahead of time, hey, we're going to learn about balance this week. So I want you to explore around in the neuro exam app and look at some of the balance tests. And then we're going to talk about it and we're going to practice it. Imagine if you had that ability ahead of time. Right? So this is all the techniques for the Cardiopulm app that we use in the labs. the assistive devices, as I'd mentioned earlier. We filmed how to fit all the common assistive devices, all the common gait patterns you can see here, all the common gait patterns with the different assistive devices, right lower extremity affected and left lower extremity affected, or if in some cases weight bearing versus affected, we filmed them all. And now the students can watch it, they can share it with their patients, they can learn it so fast and revisit it anytime on their phone. So we've filmed, we have all the transfers, wheelchair fitting, that entire class is covered by one app. And the reason why we built it was we looked at the textbook together and we said, it is so hard to learn this by looking at pictures. So let's film it for them and allow them to learn it through visual, audio and reading. So the goal here is to be able to allow students to learn beyond the boundaries of the curriculum. They don't have to wait until that moment when ortho arrives and I'm going to bombard them with new textbooks and bombard them with all these new concepts. I'm going to trickle it throughout the curriculum and tease them along and give them free rein to explore and make sense of their world. I think this is a very, very important concept to extend learning beyond the confines of our 8-week or 16-week curriculum borders, boundaries. So actually, let me just take a minute and open it up to comments or questions about that.
There were 2 questions that we didn't get to address before, so
Sure.
I'm just going to go back to that. Great example about reducing the number of shoulder tests. What is your basis for selecting what to present?
Yes.
Knowing you may see various other ones on their clinical rotations or on the licensure exam.
Yeah, so we work very closely. I'm one of the guideline writers myself. We are working on the clinical practice guidelines for medical screening. For example, shoulder lab, one of my favorite labs because I can't remember half the things I thought I used to have to teach. We talked a lot with the guideline writers, Amy Seitz, about what are the special tests that they're teaching. Do we have to show them all of it? So if you can, for example, if I take you through the orthopedic app and you look at the slap lesions, the instabilities, we decided that we were going to trim the special test. Here's the key findings for this condition, so instability. We have clumped these tests so students know, oh, here's some instability test. And here's the main ones based on their validity as well. So sensitivity, specificity, likelihood ratios. So we've been in conversation, and this list is going to evolve. As new tests that are better come up, we will remove old ones and add new ones. And there's certainly faculty members who are like, hey, you're missing this particular one test. I think we had taken out Apley's for the knee. And they're like, hey, this is going to be on the MPTE, so we're going to film it and put it back in. We just felt like, hey, between McMurray's, Thessaly's, joint line palpation, you had plenty of tests to determine whether a meniscal lesion was involved. And you can see for labral assessment, these are the 4. These are the 4 that I teach. I don't teach any more than that. Because any more means there's 7 forks in the road every time they come to a decision, what test am I going to do? So it adds to the confusion. So we have tried very hard to be in touch with guideline writers, as well as being in conversation with faculty members like yourself, and then we weigh the pros and cons of adding new tests in and taking old tests out, and try to weigh the cost-benefit ratio of having too much. I mean, a lot of people have been writing saying, hey, how come you don't have just a special test app that has all the special tests? Because it was really not a problem I was trying to add to. All of us who teach musculoskeletal know that the students leave our program and end up becoming special test specialists. And so we have tried to clean up a lot of that chaos. The second question?
For peds, what type of diagnosis does the atypical baby have? I would be.
You know what? I will.
Typical baby.
Say that again.
It would be great to generally have a typical baby, a baby with low tone and a baby with increased tone.
Yes, exactly. So, of course, capturing that is not easy. We we have one baby that is not developing quite normally. We are going to follow that baby over the first year, or capture moments of that. We have definitely the babies that are demonstrating normal development. That will be a very useful tool for faculty, because now you can go month to month and look at them doing different functional tasks and be able to just talk about it with your students. We're done pretty much filming the 12 months using different babies. It'll just take a little bit of time for us to process all of that and build it into the app. But yes, that's exactly what we're looking for: high tone, low tone, and then so-called normal development. So great. Let me move on. We're almost done, and we can have more conversation as well. I want to show you this idea that a faculty member actually had mentioned to me. She said, you know, it'd be great after I'm done teaching GATE, which in the GATE app, every single piece that you need to teach GATE is there. The phases, the range of motion. In fact, let me just show you real quick. In the GATE app, in the learn phase, we decided that to learn complex movements, things need to be static and they need to be on humans. And you can see now we have overlaid a range of motion requirement for that phase, and it's connected always to an image, because that's when things make sense. The same thing for EMG and critical events. So you could basically jump from phase to phase, and when they're ready, you can move into analyze. So in analyze, they now have the pieces of what they need. Now we can look at GATE in regular speed or slow motion. And from there, you can basically change the view. Just like we would do as clinicians. Or look at range of motion in real time. We used, of course, wireless EMG and wireless motion sensors to do this. And you can now have conversations with your students. Have them analyze the movement. Make sense of why certain muscles are doing certain things during certain phases of GATE. Here's anterior tib. It's about to go quiet. There you go. So we really think we're actually taking this template and filming all functional movements based on this same idea. We're hoping to present about this at CSM next year. What I was alluding to in the presentation was that the faculty member said, I would love to have discussions about patients. So we have a bunch of patients that we filmed. So let's choose this 57-year-old female with medial knee pain. Here's her case. Everybody go ahead and take a moment, read the case. Now this is year 1 students. They have had no ortho experience. I'm just trickling in some information that I want them to begin to realize is important. And then we're going to watch the video together, and we can watch different views. And I would have told them that when we looked at the deviations, which we filmed all the common deviations, I see a varus thrust in this patient. Oh, a 50-year-old woman, female with a stiff knee, and this is how she looks. I got it. That makes sense. So I asked them, hey, in your range of motion MMT class, what kind of things would you, if we look at how she's walking from the side, what kind of things would you like to measure? Oh, it looks like the knee doesn't have full extension. Great. You guys remember how to measure that? What kind of muscles do you think we should check? What are the shock absorbers for the knee? You can see how these types of tools can now begin to build bridges forward, backward, laterally. I think this is very important for the evolution of our profession, is to be able to have tools to do this more. And so we have a lot of universities who are testing it, beta testing it, adopting it. And what I love most is as they are sending me screenshots of things that they think are not quite right, that we can modify, things that they need. Recently, I think he's the incoming president of the geriatric section. He said, hey, you know what? Your app would be a great place to integrate some of these geriatric concepts. So he sent me a few articles about fall risk assessment. He said, wouldn't that be useful if all of your students who are learning about hip osteoarthritis in their differential that they would consider a fall risk screen. Great. So I built a little PowerPoint, added a few key questions. Eventually we'll link these directly to the tests that are in the Neuro Exam app. Right? So you have the Neuro Exam app. Here's those balance tests. So all of these techniques that are being used in multiple classes, you can build bridges endlessly. So we are now exploring. What other apps faculty need us to build. So PEDS is almost done. P&F is 90% done. We built this with one of our alumni who is an instructor with Kaiser Vallejo. Medical screening we just finished because our students were complaining that it seems like such an important class, but we have no real resources or videos. So we filmed all the systems, the basic system screens that you would do for each of the medical screening class. Someone mentioned wound care. As most of you would probably know, wound care is a challenging. We always have low board scores on wound care, and we've tried every different iteration of trying to teach it. I don't think it's actually the content problem. I actually think it's the clinical reasoning, case study based experience that is absent in that particular small snippet of wound care that we give them. So we're starting to build games. So the games will now have certain wounds at certain locations, and they're described with such a smell, and they'll have options. Do you want to enzymatically debride it? Sharp debride it? Do you want to dress it? And if they choose the right thing, they get rainbows and unicorns, they get a little bit of money, there's a patient satisfaction meter, and the next picture they see, hey, the wound looks better. I made a good choice. So I think we are building that actually for cardiopulm, for ortho. We will eventually build it for neuro as we continue to collect videos of these patients. And now students can begin to make choices that are risk-free. I think that's one other thing I would throw out there to you as faculty, as colleagues. When the risk is too high, when everything is about passing and failing, this is not a safe harbor for people to explore and learn and make mistakes and get better. So sometimes I feel that using these tools, giving them quiz questions that have very little point value but help them to shape their mind around the content, giving them cases where they can see how you think, what you would do. In the orthopedic apps, I play every single common pattern out with them. I play it on the first day of knee week. I talk about knee OA, what the exam looks like. These are the techniques that I'm going to show you in lab. Do you remember some treatments or exercises you've seen in the past? Do they look like these that are here in the app? I'm building context all along the way so that by the time I open the fire hydrant at lab day, everything's contextualized. They know where everything goes. And I think this is part of how we create clinicians, not just people who have received all the material. So just as this will be a talk for another time, but we are beginning to run a study where we're giving these types of resources, the apps, to our CIs. I will do an onboarding for the CIs related to, and this is for ortho initially, how are the clinical practice guideline concepts being integrated into entry level? And then I will show them how I'm using these apps with my students and my residents and fellows. I'll show them how I'm using the app as a benchmark to assess and give students some sense of what is expected of them. And then we are going to do a focus group with the students and the CIs and watch their clinical scores and see if there's an improvement. So we are now exploring building bridges not just from the beginning of PT programs, but all the way through the clinical experience into residency and fellowship, because I use it. I mean, I use this all the time with mentoring the residents and fellows to clarify the practice patterns that are based on the guidelines. So actually, I just want to open it up. I know we're almost close to the end of the time. I want to open it up to get some comments, some questions, some ideas, and to let you know that I very much treasure you spending the time to explore what would it be like to break free of maybe to augment the traditional way. So I'm just going to open it up. If you want to unmute yourself, I can take a moment to try to unmute unmute people who want to speak in. But this is a great moment for people to just share their thoughts.
I'm going to jump in here. Stacy Fisher, I know she asked earlier before, do you have any interest in wound care and debridement techniques? And then her second question related to wound care, again for wound care, the student needs to also see the actual tissue if they're not actually performing the dissection in an anatomy lab, or even those using virtual anatomy. I like the way you're addressing the clinical reasoning.
Yeah, you know, I think these apps will always augment the instructor. My goal is never to get rid of the instructor. I believe in this model of teaching. I think our model of teaching needs to evolve, though, because we need to find time in the classroom. I think that can be a conversation for another session about how we've done our blended learning and some of the challenges and things that worked well. That I think that would be a great conversation for a number of us. The wound care app, we are collecting pictures and videos of debridement, of different types of wounds, and I hope that what will happen is the students will play out the most common patterns, and we'll see how all this knowledge that we're giving them, how it plays out. And I think that could earn us an extra 3 or 4 extra points on the NPTE, which could bump, you know, we've been fortunate to have 100% first-time pass rate over the last couple of years. We still have people taking exams now, but I think some of that, it's very difficult to just toot our own horn and say, hey, it's because of these apps. I really don't think that's the case. But I think the students are telling us that in the clinic, in the classroom, the ability to access this type of information, they really appreciate it. And it helps, it gives them more options to learn the way that they need to learn. So, yes, we are interested in the wound care thing, and I think I will make a note to reach out to you, Stacy, to further that conversation as we evolve the wound care project. Any other questions from colleagues or comments?
Mike, go ahead.
Yes.
I really don't have a question. I just have a comment that I think this is really going to be very useful. It's, I think, the way of the future, and I really like there'll be a lot of work on your part, but it'll make our jobs, I think, in the classroom and trying to get more application a lot easier. So thanks.
Yes, great, fantastic. Thank you for that. Next.
Hey, Mike, it's Tony from Las Vegas.
Hey, Tony.
So I really agree with your statement on your previous slide about the students learning in silos, and I think your attempt at the early intervention email week overviewing the diagnosis is excellent, especially, you know, a review of the anatomy so that they're taken out of that that the silo is now being dispersed to cross the bridge analogy there. I thought that was excellent.
Yep.
I have a question about that. What is the complexity that you're getting into on those series, and is that potentially something that could be utilized in that type of format in the app, or are they trying to achieve different goals, I guess?
So if you look at the email series, it always starts with clinical pattern recognition. Sunday is, hey, I'm going to make the knee that you're going to be cutting into relevant to you and the things that you kind of might already know. So Sunday is always this 1-minute entertainment. I just want to see what a patient with knee OA kind of sounds like and looks like, right? So technically we built seven of these emails, but the reality is the students can't handle one email every day. At some point, the students are just going to explode. So we've chosen to hold back on that. And we've chosen 2 or 3 most common patterns: a stiff knee, a loose knee, and something that hurts when you generate power, like patellofemoral. And we're going to say that this is just a primer. This is not graded, but I want you to see where this shows up in the app, because I want you to learn and feel free to play. So the students can go, oh, knee OA, yeah, my dad has that. I'm curious, what am I supposed to do for the exam? Oh, the exam is really just range of motion and accessory mobility. Cool. I kind of know that. Oh, signs of central sensitization. I have no idea what that means. I'm going to wait till later. Great. because you don't need to know all about it now. This is actually just Carol Courtney mentioning to me, hey, you know what? My research is showing students should probably begin to consider this. Great, I'll film it, I'll put it in. They have little clinical reasoning videos about what the exam should look like, so all of that's built in. Many of our students will watch this and kind of conceptualize what does it mean to assess mobility deficits. The goal of these email series is not to be in-depth at all, but only to trigger some type of connection to something that drives their continued interest in learning, so that it gives them an outlet. It gives them a way to explore. And so we purposely just chosen very common tests, very things that they might have already seen before, but we're patterning it out in the early days. So I don't know if that helps.
No, it does. And I think the idea is excellent. I guess my interest would be on if you took this same concept with the review of the anatomy and everything, which I know there is the links within the app itself, but let's say you made it a little bit more complex, where you could we could actually choose from these cases and actually outline it as a full day of, series basically for the most part. So including the anatomy, the links with the special tests, the outcome measures, all that kind of stuff. I know they can find it in the app with itself the way it is currently, but I feel like you're really you're putting the whole puzzle together with this email series, but its intent is just different than a more complex situation.
It is because the more complex conversations occur in musculoskeletal 1, 2, and 3, or ortho 1, 2, and 3. So, but
Gotcha.
I don't believe that those conversations can be very complex unless I'm seeding these thoughts and these ideas. I'm seeding it early. It allows me to be more complex later. So I think,
Gotcha. Okay.
This is why we built this.
I understand what you're trying to do.
Yep. Great. Any other comments or questions?
Yeah, Mike, this is Steve Lyos. Have you actually done this yet with students and seen the impact of it, or is this the first time you're trying this introduction to the topic early?
You mean, actually, this year is the first year we've done it. And so the students are getting 3 to 4 emails a week based on an email drip system that we have set up. We can help you with that. If faculty members, you can see here at PhysioU.com, all of these we're building. Faculty have access to all of them. Here's the anatomy series. We're going to continue to build them all. And so you can choose to say, hey, you know what, students, I would like for you to go in and take a look at the patterns. I'm going to send you a link. Go and check that out. And the link, actually, we have 2 versions of the email. One version is they don't even need the app at all. They can just view the little video. But to me, the real value of these, for my purpose, is to invite them to see where a Lachman's test lays within the app. So it is actually part of an ACL assessment cluster. It is actually part of the physical exam and the key findings. So my goal here is actually, it's basically a soft onboarding to more and more complex conversations that I am reserving for myself as the expert when that time comes. But I am trying to avoid the deer in the headlights every week, the deer in the headlights. I'm trying to build that bridge. So we are doing this currently as we speak. We are releasing these emails every 2 or 3 days.
But this is the first time, because my question is if you actually seen that this has improved students' understanding, or is this something you just we're assuming early introduction will then lead to improved understanding?
That is still yet to be seen. We will be conducting focus groups. Students, I will just tell you that I have plants in every class that I ask them directly about feedback on all the things that I'm experimenting on. And the moment we released this email series, we got a plethora of emails. We actually emailed it to all 3 classes. The group that's in the clinic, the group that just finished ortho, and the group that's right in the middle of gross anatomy. emails from each of the groups had different comments like, oh, that was so useful to refresh that this technique goes with this pattern. Or in the anatomy group, they're like, oh, that was so useful because now when I go to the anatomy, it allows me to have deeper conversations with the TAs and the instructors. And the guys, I was surprised, the guys who just finished ortho with me 4 weeks ago are like, that is gold. Because we can't process it all at once. So by trickling these things to us, you allow us to revisit things even though we're out of your class. And so I think anecdotally, the students will basically tell me, hey, that's way too many emails, please shut it down. I've given them the liberty to do that. And at the same time, I've also given them liberty to tell me, hey, what's too much and what's too little, or is it helpful or not? I will report on that again. Like I mentioned, we are doing a bunch of focus groups related to this. Certainly you have to build it first, test it, and I will definitely make a point to, probably in one of the future webinars, to share. But right now, the comments are very, very positive. Any thoughts about that, Steve?
No, I was just
curious.
Yeah, I was interested to see if you saw any effect or anything, because
it's hard to tell.
For the other part on the I can understand the ones who just completed and the ones who are on the clinic. We're looking at it as a review. I guess my question is also, in the long term, to see how it pans out for the ones you're supplying it earlier, because in my opinion, I think there's also a potential for too much information too soon that then leads them to draw incorrect conclusions, or that you're then trying to address later on, just because they don't have the knowledge base to conceptualize it as much. And so it'll be interesting what how it comes out for you.
Honestly, I don't think they're going to remember much. But I think what's happening, my design for this, as we're building this, I said we are just going to choose 1 or 2 common special tests they have probably seen or heard before. I'm trying to bridge to previously known knowledge. I'm also trying to bridge into the app to show them where this stuff is located. So it's almost like the intro walking tour of the app. I believe that when it's time to craft the story about how we manage people with ligament instability and movement coordination impairments, when we have that conversation in ortho, this is only just going to be a small seed. There's a lot. This will be another session that I'll share deeper about how I go weekly with the app, developing their patterns, the upsides and the downsides. Part of what you're talking about is confirmation bias. There's inevitably, when you're talking about patterns that are very clear and very strong, they tend to hang on to that. They claw onto it and won't let go. But I really believe that some of this pattern, the beginnings of pattern recognition, and playing these patterns out later again, revisiting it over and over, is better done over time than in 1 week. This is knee week, you got to get it, and this is the first time you're going to hear it, and you got to get it now. I just don't see that as functioning well because I've tried it for 10 years.
I agree with you, and I will say that I guess the benefit on the positive side, and not to take up more time here, is just to say, because you are the one providing information and you are the one, they're getting the same information and reconfirming it, or getting it a second time from you. Later on, when they come into your ortho class, you may see a different result than, say, what I'm relating it to is that the anatomy instructors at our program have the students for a final project complete a come up with their own patient based on the information that they're acquiring, and so their level that they do it is at a much lower level, and they make these incorrect
assumptions and
so
conclusions.
Yeah, and then they come into ortho, and so I'm working backwards to break those patterns to reestablish a different. So I think I was hoping you were going to say you've done it for a while and seen good success, because I think my expectation will be that you might, because you are providing them the information and then confirming it to them and reviewing it with them and then adding onto it by adding additional tests and measures.
I think, Steve, what you're talking about is a great conversation for you to have with your anatomy faculty, which is what we are always trying to do, is not have to undo something that they're spending time doing with the students. But I can see exactly where you're coming from. And you're right. I think the things that we've chosen to show are very, very low level. There isn't that much reasoning built into them because this is not the platform to do that. But they will see that, you know what, we do quad strengthening and some type of instability testing for this type of patient, and I'm going to tell you more about it. I want you to be excited about it now and when it's coming. So I think you're right. There's a place for that type of reasoning. It's not here. This is not the tool for it. Great. Any other comments or questions? So what I would like you to know is that every single one of you as faculty members have access to all of our apps. So if you go to PhysioU.com and you sign in, you can put in your email, your faculty email, and put in your password, which is just a generic password. So we have built this tool to make faculty lives easier and to help students learn better. And you can also, if you're an Android user or an iOS user, you can just go to the Android store and look up the PhysioU app. It's the complete rehab guide. This PhysioU app puts all of these apps in the palm of your hand without using any of your memory, because it's basically the web app re-wrapped up into your phone. If at any point you are interested in chatting more, we will be doing a deeper dive into how I am using this in my class. Here are some other webinars that we'll be sharing. I'll be bringing in our faculty to share how she's using it in neurorehab, what we'll be building, how we're using it in cardiopulm. I think it's very important for the orthopedic professors how I'm leveraging the clinical practice guidelines to make my life easier throughout the curriculum. So these are some upcoming webinars. And I would love, as you're playing with the app, please feel free to email me screenshots, things that you'd love that needs to be built. A colleague from CSM this year said, hey, would you film some prosthetic gait deviations? And so we've set up all the common prosthetic gait deviations, and we're going to add that into the gait app so that students can look at it, see it, revisit it. Please feel free to reach out to me, especially if you aren't able to get your access. And I would love to have more conversations with you, to share more or to get your thoughts. This is not the answer to all of PT's problems. This is just my love for the students and the love for teaching, and an attempt to share these tools with faculty and students. For students, you can imagine all of these apps are a one-time fee for students. So imagine all the different classes that we're covering: PNF, wound care, PEDS, functional movement analysis. All of these apps can, even if you replace one textbook that you didn't like or didn't function well, this cost is equivalent. It's $199, one-time fee for all the updates and all the future apps. For faculty who are doing group adoptions for their program, we basically do a 50% off. So it's like, hey, I want my students to use it. They're going to use it throughout the curriculum. Great. Then you send us a list of students who want to sign up for it. We email them an invoice that's 50% off. It's $99.99, and they have it with them for life with all the updates and all the new apps. So as you can see, we are not trying to overburden the students. We're not trying to overburden the students. We're trying to save them from certain costs. If you find that certain texts are not working well for you, we hope that this will be beneficial to you, and we hope that you'll be a part of helping us continue to build cool things that will help students become great clinicians. So I see there's just a couple last questions here. I think the question, are there any questions that I can't see?
There's a question from Denise.
Yes.
When do you think you will have the prosthetics gate?
Prosthetics gate will be up after summer, unfortunately, because it'll take a little bit of time to get the green room ready to film the way we need to film. I don't think we're going to film it on a treadmill. I think we're going to film them with some equipment and follow them in different views. So yes, we've already made the list. I have a colleague out of Wingate University who has made a list, and we've already populated the content of the list. And we're going to be filming, but it's probably going to be after. You can see here, we're basically going to do transfemoral and transtibial. And here are all the common gait deviations that we're going to film. So it'll just take us a little bit of time. As you can tell, I'm trying to produce a lot of stuff, and all of it costs a lot of money that we are trying to not, burden the students with. But you can tell that at $99, this is this is really an effort to continue to develop cool things for us as educators and for PTs.
The next question is the access for the faculty only for the trial period?
No, access for faculty is lifetime. So you're just going to keep getting more and more apps populate in here. So once you sign in, it's yours. Please feel free to use it. That's why we built it. And if you have adjunct faculty or faculty members or friends that you don't think has gotten access, please email me. I'm happy to share it, and please feel free to use it in the classroom. I've had faculty come up to me at CSM and say, "Hey, is it okay if I use the gate, and have the students look at this and use this in class?" Yes, please do that. I mean, that makes all of the hard work for all of the authors. It makes it all worth it for us. So I think it will be, I would encourage you to explore. And as you're exploring, please do not feel at all, please feel free to reach out to me with emails and comments and phone calls, because I love connecting with faculty and trying to figure out how to do this thing better. Any more comments or questions? Okay, well, I want to thank every single one of you for spending the hour with me. It's been fantastic. I hope to stay in touch with all of you. And again, feel free to work on the apps, play with the apps, and look out for some of our other webinars that will come up more specific to certain content areas. I think we have a lot to share there. And I'd love to collaborate. If you have ideas of things, I have so many ideas, just not enough time, as all faculty have. But I think one thing that we all share is a love for teaching and a love for our students. And I hope that each of you will partner with us in continuing to build these cool things. So feel free to email me. Things that you see that are wrong, please let me know. I can just refilm and update it immediately. And the tool will just keep getting better and better. So thank you, everybody.